All right, perfect. So we are recording, so we'll get started this morning. Today we're getting together to talk about Module 3. I know for a couple of you who weren't here last time, this Google Drive is available to you. And as you can see, Tim has very eloquently posted our first recording from last week of Module 1 and 2. So you're welcome to go back and check that out. Today we're going to be going over Module 3. And Module 3 is guardianship and supported decision making, what health professionals need to know. This module was originally developed as informational only on supported decision making. And we realized that we really needed to help put that into the perspective of guardianship, as that is one of our primary decision making tools that's still used in our disability community. So we adjusted it a little bit and added a little more information. So let me see if I can just adjust my window. So typically, as last time, if it's all right with everyone, I'm going to present these in this mode here so that you can also see some of my notes that are available with each of these slides, because I think when we're talking about the perspective of giving you the perspective to potentially teach them or use content from them in the future, it's helpful to see what some of my notes are. And I'm really an informal presenter. Please, if you have questions, interrupt me. Like literally flip your microphone on and say, "Hey, Julie," because once I get on a roll, but please interrupt me and ask questions. And of course, we'll take some time at the end for questions if we have it also. So let's get started into this module if that sounds okay with everyone. Great. Excellent. So each of these modules will have this acknowledgement slide. I know we're working on maybe a slight adjustment to this acknowledgement, so we'll replace that as it comes. But just wanting to remind those individuals utilizing this content that the Youth Health Transition Initiative is funded by the MCH Title V Series Block Grant through the Maternal Child Health Bureau, Health Resources and Services Administration, U.S. Department of Health and Human Services. And with this licensing, we give individuals, we disseminate this information. You're allowed to distribute it, remix it, adapt it, build on it. But we just ask that you always provide that acknowledgement and attribution to the Youth Health Transition Initiative as the creator of this content. There's a slide here just with a bunch of letters, so you know where I came from in my background and my qualifications. Um, we always, whenever we do our work with the Youth Health Transition Initiative, we are always talking about the network of partners that we come from, because that's an important background. It's an important resource when we talk to different groups of people. And a lot of people don't know about this network. And so it's really helpful to kind of tell them where we're coming from, where our funding comes from, and hey, there are some other partners that might be beneficial to you. So as you can see there on that slide, you can see all of our children and youth with special health care needs network in Wisconsin. And that Health Transition Wisconsin falls on that network of partners. The initiative and the purpose of this initiative is to ensure that high quality, developmentally appropriate healthcare services are available in uninterrupted manner as a person moves from adolescence to adulthood. And that comes directly from our foundational our foundational article titled by Cooley and White in 2018. And so we'll talk a little bit more about that article, and it is on our reference list at the end to reference it further. Also, as part of this network is the Wisconsin Wayfinder Children's Resource Network. This is a tool that if providers and families take nothing away from these trainings, we want them to know where they can go to get more information, to figure out who we were and what we were doing and how we can get them more information. This is a wonderful way for families to access all of that information in Wisconsin. And so we have this slide on all of ours, and this is also in partnership with our children's resource centers. There are 5 resource centers in Wisconsin. In the great city of Madison, we fall into our South Resource Center. Over there in Milwaukee, you guys fall into our Southeast Resource Center. So a direct contact number there, and also will help connect you through the Wisconsin Wayfinder. All right, so our learning objectives this morning. for our current module of supported decision-making and guardianship. One, describe the differences between supported decision-making, shared decision-making, and guardianship. Recognizing the role of the health professional in facilitating family decisions regarding tools to promote individual autonomy. Um, Discussing those situations in which a healthcare professional could use these different tools to support individuals with special healthcare needs, and where to access some resources supporting the use of supported decision-making tools potentially in practice. So one of the opportunities we're going to take just a few minutes to enjoy this morning, because I could talk all day long about supported decision-making, but sometimes giving you a short vignette or an experience can be far more valuable than 4 minutes of me rambling. So we're going to take just a moment to listen to this short video about supported decision-making and some of the work that we've done with families. You pop over here. Y'all seeing that video on your screen coming up? All right. Let me know if we don't have audio on it.
I don't hear audio. This is Gina.
All right. Hold on just a minute. Sometimes I have this trouble when I have AirPods in. A minute. Let's see if that will fix us. Let's try again.
Thank you for having me. I've been involved in supported decision-making great number of years before even the law. I was also involved in the group that drafted the law that we have in Wisconsin here. And the impetus for that is for the young man you see on the slide in front of you. I did get his permission to show this picture. He has his own person. We try as his parents, my wife and I, to include him and ask his permission when we share stories about him, that he recognizes that if we are going to move this world forward for people with disabilities, that some of us, including him, have to be willing to get out there and share our stories. A number of years ago, I went to a presentation by Jonathan Martinez, and he talked about the concept of supported decision-making, and to use that instead of guardianship. And I was intrigued by that concept and have followed that concept of supported decision-making ever since. And when my son, who's in his early 20s now, was getting ready to turn 18, we had to figure out as a family whether or not we were going to go forward with guardianship. And there is a tremendous amount of systemic encouragement, this word I'll use, for going for guardianship. Our system is very much geared for that. It's a way of a parent always having access into either a financial meeting, an IEP, or even healthcare. But Franklin has a rare form of epilepsy. And for that reason, I've been very interested in following neuroscience and neuroscience research. And what we found is that the brain physically does not fully develop until about age 24, age 25. The research shows that the more autonomy and more independence an individual with a disability has, a cognitive disability has, that they can start to understand boundaries and protect themselves better. I will admit that we went partway down that path to getting a guardianship, and turned out that that was not the right path for us to go. When we got into the process and saw some of the effects on our son in terms of his mood, what it is that that could be said about him, that he was going to be publicly declared incompetent, we just couldn't go that route. So we decided to use supported decision-making as a way of allowing him to grow, to provide support for him to make a decision. Guardianship and even powers of attorney are substitute decision-making options. And that's where somebody else substitutes their judgment. So we've used this process with my son, and I can tell you over the last number of years, the growth in his maturity and what he's doing. is been tremendous. I mean, right now he is employed in the community as an essential worker, making more than minimum wage. I will also say guardianship may be appropriate at some point in time for him, but I can tell you it will be a limited guardianship. We're still learning. And that's the other thing about this window of 7 years. It gives you a chance to really understand your loved one and see how much more growth they have. Because if you just stop it at 18, you really limit, in my mind, the amount of development that can happen. So that's been our experience. That's my son, and I'm as I said, I'm happy to educate and participate in this presentation.
This.
All right. So that was George Zaski. He is a local attorney here in Wisconsin. That video was filmed a few years ago. Um, Actually, I think peak COVID. So his son, Franklin, is now a few years older, into his mid to late 20s. But George was really gracious. He actually did a longer presentation for us as part of one of our learning communities. But then with his permission and his son's permission, we were able to take that longer recording and kind of scrunch it down into that short 4 minutes to just kind of capture the essence of supported decision making, and what it kind of really looks like for families who are in the day-to-day. One of the things I always say about that video, a lot of people ask me about that comment that George made about that 7-year window. And they're always trying to figure out like if that's a special magical legal time frame or what we're talking about there. And what George is really referring to is that approximate 7-year window between age 18, when someone might be able to make their own decisions, and age about 25, when that frontal cortex kind of completely develops, hopefully, in young individuals. So that's the 7-year gap he's talking about, in case anyone was thinking in their brain, what is that special 7 years he's talking about? I get that question a lot about that video. So um, I think just a great launching point for us to delve into some of the next pieces of supported decision making and guardianship. So one of the very first things that I like to clarify, if you're not a healthcare person, you may have heard of shared decision making. If you have worked in healthcare for years, you are absolutely familiar with the concept of shared decision making, and they often get confused, and that's why I just make this clarification. Shared decision making is a model of care that applies to anyone and everyone, and we should always engage and inform individuals and patients in our care when we're talking about decisions and opportunities. So that is really just a model of care. We today are talking very specifically about supported decision making, which is a legal process for individuals who are at least 18 years of age with a functional impairment, which we'll talk more about. And it is a legal signed agreement between the individual with a disability and those individuals whom they are choosing to help support them in the world. So I just always like to make that clarification. I will also tell you that just like the nurse practitioner who helped me create this module, sometimes when I give it, I start saying shared decision making because it's been in my vocab for years and I have to correct myself to supported decision making. And also, if you see those initials, that SDM, we are specifically referring to supported decision making in this module. All right. So there are lots of other decision-making tools that are available in our arsenal when we talk about patient care. And so we like to talk about those. And the next slide is a really nice visual kind of um, representation of some of those different things. Um, we've probably all heard about these. There can be things as simple as release forms, power of attorneys for healthcare, guardianships that can be limited or full, as George referred to in his video. Um, Release forms are very simple and just say, hey, you can talk to this person about anything related to me. Powers of attorneys get a little bit more complicated as a legal document that's really directs to very specific people that can act on someone's behalf, and there are very specific situations in which they can be utilized in our state. And then there's this idea of guardianship, and that really, it's important to understand that is a transfer of decision-making power to another person that is appointed by a court system. So it is a very formal process. As I mentioned, really nice slide. This actually comes from our board for people with developmental disabilities. And I love this slide because it just really kind of shows us that realm of what might be least restrictive to what might be most restrictive or limiting when we talk about decision-making tools. And so, as you can see, supported decision making is over there on the left in that blue box in this realm of a little bit less limiting to our individuals who have interest, ability, and a supportive network to maybe pursue that. Limited and full guardianship is very limiting and restricting on individuals in which those guardianship orders are placed. As George referred to in that video, sometimes it's important to think about the implications of guardianship. I can tell you that in my work with patients and families, everyone I speak to who is considering guardianship is doing it to protect the individual for whom they care for. That is their intent. That is their wish, is that that person continues to be really well cared for and protected from vulnerabilities. I think the reality is that we have to think about a little bit broader about that guardianship and what that actually looks like big picture and what the impacts can be for that individual with a disability. As George mentioned, an individual must be deemed incompetent, quote unquote. That is the legal definition. And so that can be very uncomfortable and can really impact the dignity and respect of an individual with disability. There's clear evidence that individuals under guardianship have actually been shown to have an increased risk of abuse and exploitation. So, something we're trying to avoid is actually higher when we talk about guardianship. Um, Feelings of being labeled by society and isolated, and George kind of referred to that in the process in which you go through to obtain a guardianship, and absolutely loss of day to day rights. I say I care for an individual who's in his 40s, who has a full guardianship with a parent, and he is more aware of the political environment in this world than I will ever be. He's very engaged, and he is absolutely frustrated, angry, and bitter that as an adult man, he cannot vote. And he tells me about that when we see each other. That's very frustrating to me, especially when he sees some of the chaos in our world right now. So, just something to think about. Simple things like voting on a day-to-day basis, whether or not you can get a fishing license, whether or not you can get married to someone you love, all things that can be very limited by guardianship depending on your state and some of the laws. I really like that quote from the National Council on Disability. It is an extraordinary intervention in a person's life and affairs with the inherent potential to be a drastic restraint on a person's liberty, and as such, should be an option of last resort. It is often first resort, as George referred to. It is essentially the norm, if you will. And so we're working to try and change that with this work. Um, so thinking about that, who are the patients who may need a guardian when we talk about guardianship? And these are just some kind of general guidelines. Individuals with cognitive disabilities who have impaired judgment and reasoning, higher functioning individuals whose social and emotional functioning is substantially impaired, or potentially those individuals who have severe mental illness with impaired judgment. Who may not need a guardian? Maybe individuals with learning disabilities and mild intellectual disabilities, those who have communication disorders that can be accommodated, and those with mental illness who are only impaired maybe during an acute phase of active mental illness. I always point out that the picture on these slides is the same because it is not a diagnosis. It is not the way someone looks. It is not the way someone talks or communicates. It is really an individual decision that should be made based on a person's capabilities and interests. Um, I think it's really, really important to remember This unit was originally developed in conjunction with Meg Steinley, who was one of our partners at the Southeast Regional Center before her retirement a few years ago. And she had an adult disabled son that she had guardianship over. And she helped me make the slide because she said, I think it's really, really important for healthcare providers to remember how hard this process is also for parents and caregivers. Can an individual make their own decision? Which rights should I help them retain? Why do I have to go to court to keep doing what I have been doing for the last 18 years to care for my child whom I know best? How much is it going to cost me? And how do I even find an attorney or someone to help me do this that has experience? So lots and lots of struggles for parents and caregivers when we talk about guardianship and supported decision making, but essentially guardianship. One of the things that I think is important is trying to help identify resources for guardianship. That was something that Meg thought was really important because it is absolutely still the best pathway for some families caring for their loved ones. And this one is especially pertinent in your Milwaukee area, so I left these slides available for you. So this is something that we'd want to check into on a annual basis to make sure that this guardianship clinic still exists. But then also that third bullet point talks about Aging and Disability Resource Center. Every county in Wisconsin has an Aging and Disability Resource Center, or what we call the ADRC, and they are a great resource that you can tap into as your youth gets closer to that 18th birthday to find out what your guardianship resources and opportunities are within your county. So we talked a little bit about guardianship just to kind of give that background and some thoughts around it. I want to delve then into the supported decision-making aspect. Supported decision-making, as I previously alluded to, is a comprehensive legal process identified in Wisconsin state statute, and it enables an individual to make important life decisions. Our goal is that adults with disabilities are able to appoint people they trust, which are what are the supporters in this agreement, to help make those decisions as they identify that they need help with the goal of promoting autonomy. Um, with this work and the nurse practitioner who helped me develop this module, we had a lot of conversation with a nurse practitioner that did some supported decision making. And so interspersed in this module are just some quotes that I think are helping us to be thoughtful about this process. And Jen Gunderson says, you know what, a lot of people have a really fixed belief about providers and they should tell people what to do. And so I think it's important to think about that and take that consideration in mind when you're caring for people, that a lot of people come in the door saying, you should tell me what to do in this situation. And I think that it's really important that we are involving individuals with disabilities and their families to really push that back on them and think about what might be the best choice for them together, not just the provider's idea, of course, with input. So who's eligible for a supported decision-making agreement under the statute in the state of Wisconsin? They identify an adult with a functional impairment, which is broadly defined as a physical, developmental, or mental condition that results in major life limitations. Um, and so it is a broad statement and allows opportunity for a lot of differences and different abilities to potentially benefit from supported decision making in Wisconsin. And so just a couple of scenarios they throw out. I don't intend to go through these in detail this morning, but these are in there because sometimes these are opportunities, especially if this would be used in a classroom environment, to really spend a little bit of time in talking about these different scenarios and what individuals think might impact how to help this person identify the best supported decision making versus guardianship opportunities. Or something else, right? Like a healthcare power of attorney or a simple release. So there's just a few vignettes in here that we've thrown in for individuals to maybe take a moment, pause during this and think about. And so I will leave those for your review. And as I mentioned, when we recorded modules 1 and 2. Sometimes these aren't appropriate for depending on the environment you're using them in, and then they can simply be hidden slides to move on with the content. So, healthcare professionals' role in assessing decision-making capacity and helping to provide an appropriate recommendation. It's really, really important if you are working with individuals and families and you're going to make a recommendation to consider supported decision making, that you have some background for how to help assess that individual. I think the bullet point number 1 is probably the most important place to start. And that is from that position of you need to start with the assumption that this individual can make decisions. We talk about this a lot in different avenues of our work with families when we do Building Your Bridge, which is one of our educational modules that goes with families. We talk about decision making. If we don't allow individuals the ability to make decisions, they don't learn how to make decisions. None of us got here today at whatever year of age we are, making awesome decisions on a daily basis because we were born here. We had family, friends, mentors, bosses, workplaces, homes. We had opportunities to make decision with guidance to help make good decisions. And if we didn't make good decisions, we had someone to help us recognize that and maybe figure out what a better decision would have been. For our youth and young adults with disabilities, they often are not given the same decision-making opportunities that neurotypical youth have. And so if we're going to ask someone to start being able to make decisions, we need to give them the opportunity to do that. We need to give them the opportunity to fail and help them learn how to make different decisions. Obviously, that's something we want to do in a very safe and controlled way. We don't want to have our youth have failures that are catastrophic or legal implications or maybe lifelong health or mental health implications. But we need to allow individuals the ability to learn how to make decisions. And so I talk to providers about that and what that looks like, and starting with that assumption of they can make decisions. We may need to help facilitate how they do that, but they can do that. I talk to providers about talking to the client directly. Um, and this is a balancing act, right? We have parents and family and caregivers who have provided everything that individual needs for 18 years. But we also need to talk to the client about what their interests and their needs are. We need to be cautious about a caregiver who wants to direct all of the work. We need to make sure we have everyone's engagement and involvement. Um, Really importantly, when we talk about supported decision making, what are the decision making supports that are in place? If we have an individual who lives in a limited environment, maybe a group home or a setting where they do not have natural supports or family or caregivers or friends and family, that may be more difficult. Supported decision making often is much more successful in environments in which individuals have a robust support system in place. There is definitely some special considerations that we need to think about. And probably the first one that we talk about, I at times will spend more on, have we made accommodations for an individual's specific disability? So, for example, if we have an individual who has maybe diagnoses like autism spectrum disorder or others where there are sensory processing issues, and we take them into a clinic environment where the lights are bright, there's banging noises happening in the hallway, there's people walking by, there's someone knocking on the door, there's an overhead announcement of nurse assist in the lab, all of these things happening, and an individual is not able to manage all of those sensory input things that are happening, they're not going to be at their best to be able to have these conversations and to be able to talk to us about decision making. Another one is communication. Challenges can be huge. If we have someone who uses a communication device that takes more time and we have a 15-minute visit in place, And it's going to be really hard to accommodate that disability and potentially explore some of those opportunities together if you aren't able to accommodate. Um, we talked already, has the individual been given opportunity to practice decision making? That's really, really important. And we talked, I won't belabor that point. Um, has the professional had adequate opportunities to determine decision-making capacity? I've had this happen to me in my own practice. Somebody said, hey, you're really good at this disability stuff. I'm going to send this person to you, and I want you to tell me if they need a guardianship. And so I get the opportunity to meet a person in clinic one time. And yes, I have this amazing electronic health record at my fingertips, and I can see what the last 15, 16, 17 years has looked like if I have time to do that before a visit. And maybe I get to meet them on whatever given day, no matter what's happening in their world. And I get to meet them maybe with one caregiver, or maybe with a van driver, or maybe with grandma. Um, that's not fair. It's not right. And it's not how these kinds of decisions should be made. Do we have rapport? Do we have an established relationship? Have we been able to assess somebody over at least a number of visits to get a true assessment of their capabilities and their interests? Communication before recommendation, especially when we talk about engaging family members and caregivers. Having an open conversation about what are the barriers for Mikey to make good decisions. Um, what are the challenges? Who has done this previously? What kind of opportunities have you provided to the individual? And this isn't like a formal conversation. It's a, what kinds of things does Mikey know how to do and make decisions about? And what are the things that you've worked on them with? Does he take his own medications? And how do you guys talk about that? How do they get refilled? Right? Kind of asking in that indirect way, who's been making all the decisions and how did we get there? Really addressing those challenges about poor decisions, right? That is the one of the biggest challenges for families and caregivers is I just don't want them to make a bad decision. Okay, how can we help them work on making smaller decisions that have less consequences to help learn some of that decision making? And just as we're talking about educating when it's indicated, and we have some resources for providers and families when we talk about that education coming up here in just a couple of slides. Our friend at Jen, listen, what are their goals? And how do we incorporate that individual's goals within the resources that the patient has available? All right, so you've given them all the options. Families and individuals are interested in a supported decision-making agreement. Now what? What is your work and your role as a healthcare provider? So how do we initiate it? There is legal paperwork. It is available online and it can be completed by a collaborative team. And those are the necessary components for this agreement to become legally binding. So as you can see there are no forms to complete that need to be signed by a physician or a psychiatrist. There are no lawyers that need to be involved. There are no court dates or court systems. It's paperwork that's available online and it's completed together with the individual with a disability with their collaborative team that they've identified. So on this slide here, that photograph on the left actually is a photograph of the actual supported decision-making agreement form from the state of Wisconsin, widely available as a Google search. You will find it immediately. It also is accessible through a couple of these resources. So if you go to the Wisconsin Board for People with Developmental Disabilities, they have a wonderful toolkit for supported decision-making for families. And it has all of the forms, workbooks, resources included. Also, wonderful, not state of Wisconsin, but a wonderful project there, the South Carolina Supported Decision Making Project also has a really nice toolkit for providers. There's a little bit of nuance between states, but not significant, and therefore this out-of-state resource is still really valuable for providers who are looking at understanding better how to implement this from a clinical practice standpoint. In Wisconsin, I can't talk enough about the Wisconsin Board for People with Developmental Disabilities when we talk about a group and a partner that can help individuals and families navigate this process. They do workshops on this. They have a wonderful toolkit. They have a lot of resources. Um, and it is important, though, that once they get this in place and set up, individuals could have multiple supporters or individuals who are supporting them in different aspects of their life. So it is helpful that they utilize this form and make sure each healthcare provider has a copy so everybody knows who is helping with what part of their care. Um, and we talked a little bit about this in passing. Keep doing the work. Repeat, repeat, repeat. Each time you see the individual, you may grow on a different part of the aspect and then sort out where are we at, celebrating those successes, and really that personal connection for the decision-making process, right? What works for this individual and keep working away on it. Just like when we talk about transition, keep doing a little bit each time that you see each other. So when an adult with a supported decision-making agreement presents for an appointment, it's really important that a provider recognizes that the patient is that adult. It's not their family, it's not their supporter, it is that individual with a disability. They are the patient, they are competent and capable, and they are their own partner in healthcare. They are the person you are caring for. They are the person who's going to make those decisions with assistance, but it is their decision to make. Um, have to make sure that we think about a couple of these special considerations. The adult has capacity for informed consent. That is probably one of the biggest challenges and questions out of this process. Well, who signs the consent form? They do. This process has identified that they have the capacity for informed consent. And it is a legally binding informed consent. And so I remind professionals that you have liability protections. There are some exceptions to that liability, but you have liability protections in this situation. If there is a signed agreement in place and you honor that signed agreement, then you have legal protections. You are not going to be considered negligent or, that you're not doing your job. Now, that being said, if you have knowledge that anyone who is identified as a legal support individual for someone with a disability, if you have knowledge that they are neglecting, taking advantage, abusing their funds, abusing them physically, mentally, then again, we are mandated reporters, and we're going to talk about that on the next slide. Yes, we still have that exception to liability. But otherwise, this is a legal expression of the wishes that professionals have to abide by and rely upon. You don't have the opportunity in the room to say, oh, I don't think that you can do this. We need to call somebody. That is not appropriate. This process identifies that they do have that ability. Again, just a brief link here, reminder, mandated reporters. If you have knowledge of neglect or abuse, we are mandated reporters as healthcare providers in the state of Wisconsin. We know that we talked a little bit about some of the challenges with guardianship and some of the limitations. There is definitely some evidence that supported decision-making can promote some healthier aspects and improve psychological health, facilitates self-determination, increases confidence and independence, and can be part of a very successful transition into adulthood and adult health care. I remind providers just a couple of things. As we kind of have alluded to, this process is explored and carried out by the family. I think it's important for providers to be familiar to understand this process and what agreements are, so that they have a higher level of comfort talking about it if an individual may present and be an appropriate individual. And as I previously alluded, it does not require any physician documentation or form completion by healthcare providers. Doesn't require any lawyers or courts. Don't give up, one step at a time. And so be a part of the healthcare team for an individual interested in this rather than the boss or the person advising people what they should do. A couple of national resources. There is organization called the National Resource Center for Supported Decision Making, and they have some national level resources, a lot of information on their website. And the National Council on Disability also has an article about turning rights into reality and talking about guardianship and some of these alternatives. In Wisconsin, we have a couple, there are many resources, but these are two that I highlight. The Guardianship Support Center, and that is a live link there. It has a guardianship attorney helpline and also has then some information about supported decision making. So this is a place where individuals who and families who maybe are undecided as what might be the best opportunity. The Guardianship Support Center can help identify those individuals and families work through that process to figure out what might be the best choice. And as previously mentioned, the Wisconsin Board for People with Developmental Disabilities has a great amount of resource on their website about supported decision making. Again, referencing that South Carolina Supported Decision Making Project as a great toolkit for healthcare providers who want to learn more and learn more about what that role and getting comfortable with that information and language looks like. Um, as I previously mentioned, a couple of self-determination resources. So when we talk about individuals with disabilities and their opportunities for self-determination, opportunities for decision making, these are a couple of great resources. Again, the Wisconsin Board for People with Disabilities has a wonderful link there to a portion of their website talking about some opportunities and some um, things that families can talk through and work through to help assess that. And then on the bottom there, that's actually a document produced by the Wiseman Center quite a few years ago, 2017. But every time we go back and look at it and review it, it is still a really pertinent document. And it's a beautiful document that I'll let you explore on your own. Just take a minute. But it literally is a quite lengthy document talking about many opportunities, many experiences, many ways in which families can help facilitate self-determination and decision-making capacity from young children up through adolescence. And it just talks about different ideas, different daily activities, different things that you can do to help promote that for families. So if you have a family who's like, well, we'd really like to help facilitate this, we just don't know how, it's a great guide that talks about different opportunities for different ages and how you might help facilitate some of those decision-making skills. So references here, all available, most of them with an active link, so you can go look at that resource if you're interested. Our contact information we always like to have available. So if at the end of this, anyone, whether it's a student you might be giving it to, whether it's you yourself to say, hey, what was the scoop on that again? This is our email to connect back up with the Youth Health Transition Initiative. So that is our guardianship and supported decision-making module that we've created. No one interrupted me, so I think everything was flawless. No, I'm kidding. What are the questions? What are your thoughts? Tell me how I can help.
Hi, this is Vicky. I just have a couple questions. I'm quite familiar with the NLRC with, um, I'm sorry, the ADRC. Sorry, I got mixed up there a minute. I'm just curious, what is the difference between a healthcare power of attorney and the supportive decision making? Because it sounds like the supportive decision making is more for people with specific to disabilities. But I'm just wondering what would be because again, the power of attorney for healthcare, you don't need you don't need an attorney for that either. So I'm just curious, what are the differences?
Yeah, so I would say that a legal power of attorney for healthcare is a little bit more limiting than supported decision making. So, for
Okay.
example, individuals with an activated power of attorney for healthcare do not have the ability to consent. The appointed activated power of attorney must provide consent. Okay, so it's a little bit more limiting in that manner. Um, and it is often, it depends on the scenario. It can be a selected individual, but it also in some situations can be court appointed. So it is not always determined by the individual with the disability who that power of attorney for healthcare is. So supported decision-making can be utilized for anyone that has capacity. It's not specific to any specific disability. Sometimes people will say to me, hey, I have, for example, a good old-fashioned a neuropsych evaluation with an IQ level available. What is the IQ number that I can use supported decision-making with? That is not a recommendation. There is not a specific level of what we in that realm, right? There was some guidelines with guardianship many years ago, and I think that's where that thinking comes from. So healthcare power of attorneys must be activated in Wisconsin to be in place. I think
True.
that's the other piece, right? So again, someone has to be determined to be incompetent or incapable of making a decision for that power of attorney to be activated. Does that make sense?
Yeah, it does. It just sounds like it's more specific with the supportive decision making for people with disabilities versus because, and I know with healthcare power of attorney, I've only had that activated um, even a few times in practice. I had to do that with my own dad who had a very aggressive cancer
Oh,
suddenly impacting. And I know what you mean about you have to have physicians to declare them incompetent to activate that power of attorney.
right.
That's one thing I knew. Also, would you be able to send your PowerPoints? Because I could definitely see this, including this in a population health course moving forward as a resource to meeting the
Yes.
needs of our population.
So this Google Drive here, I'm going to flip my screen to it. Vicky, that Google Drive is going to be accessible. Already is. We just need to make sure you have the link to it. So you will have all of those modules with the live PowerPoint. So
Okay, great.
like I mentioned, you're able to, like if you want to hide slides or you want to add something that's more pertinent locally, absolutely.
Yeah,
So,
if you can send me the link to the Google Drive, that would be great.
yep, we'll make sure you have that.
And just a note, Vicki, on the UWM side, after we go through the trainings, we'll huddle and talk about the best way to provide this content to students.
Yeah, definitely. I can definitely see it's a resource I was not familiar with,
Yeah.
but I can definitely see it would be uh, very helpful um, as a resource.
Yeah. And Vicky, one of the things that you made me think of that I just wanted to go back to your original question. You are correct, though, that supported decision making under statute in Wisconsin is to be utilized with individuals with that functional limitation, as I
Hmm.
had noted. So they do have to have some sort of functional limitation for it to be appropriate, versus, as you said, a healthcare power of attorney could be used in any medical situation. They don't
Right.
necessarily have to have a functional limitation. And the other piece I think is important that I didn't highlight as well and maybe should. An individual may have multiple supporters as part of their supported decision-making agreement. So, for
Mhm.
example, mom has always been the person who has helped me go to the doctor's office and be seen by my nurse practitioner. Then you may have an individual with disability may have mom as their supporter for healthcare. But you know what? My brother Tony is the guy who helped me get into the assisted living place or maybe
Ah,
apartment that I share. And he helps me make sure that I can get my money and pay my bills. And so maybe Tony, my brother, is going to be my supporter for healthcare or housing decisions and financial work.
ah,
And maybe my Aunt Linda is the person who always helps me figure out what Xbox game I like, where I want to go on vacation. And so Aunt Linda might be my supporter for helping me book trips and book a rental car and travel. And so an individual with a functional impairment can have multiple individuals identified, and it is on
mhm.
that tracking form. You go back and identify who's going to help me with what decisions so that when that individual comes to the doctor's office and maybe Julie Hajewski is the nurse practitioner, I can say, oh, hey, Mikey, I see that your mom is your supported decision maker. Is that who's here with you today to talk about your healthcare stuff? Okay, great. Or it's not mom. How are we going to engage mom to help us as part of our process today? Because you've identified her as the person you want to help make decisions about your healthcare. So thanks for that question to help remind me of those couple of points, Vicki.
No problem. I think the most exciting thing that I see with this is it just gives the power back to the person with disabilities instead of just, making it more what I would call black and white. because that is definitely going to give them that independence that they need to the highest potential.
Yes, the goals of supported decision making are to help promote that self-determination and that autonomy.
Hmm. Thank you.
Absolutely. Other questions, comments, thoughts?
This is a little bit more of just sort of a comment, but again, I work in after hours nursing, and one of the really big sort of frustrations I feel is that it seems like when we have individuals, whether it's with guardianships or a lot of different things, it's almost like I feel like HIPAA is like the stick we're all leery of being beaten with, right? And I just feel like it adds this really extra layer of anxiety and difficulty because we might have someone calling us from a group home and I see that they're not their own medical decision maker, but yet the guardian's a person in California or an agency and someone that I can't reach. And or like you're saying, maybe Aunt Linda's calling and I can see in the documentation that like the clinic talks to Aunt Linda all the time, but I can't find a signed permission to speak with her. And in particular, as we're acquiring some of these outlying clinics like Beaver Dam and Janesville and things like that, different practices are kind of coming in together. And it's so, I guess, upsetting and frightening not to like center the care provider, but it's so upsetting because you want to do the right thing. You want to promote autonomy. You want to provide service in the moment, but at the same time, you don't want to go to prison or have a $500,000 fine. And so I guess I don't know that you really have an answer, but do you have any thoughts or insights for those of us who are in that situation? Or do you have any ideas for, streamlining some of those communication tools so that maybe we can understand if permission is there, but we're not finding it in the places we're used to looking for it? I mean, my default tends to be I can take information from you and I can give you the advice I'd give to anyone. I can't share anything personal from the chart if I can't find a waiver. But like I said, it is really difficult. And I feel like it puts people on an uncomfortable foot and I don't like it as a parent either. I feel like we've signed a waiver 10 times to, for my husband's care providers. And we're always like, oh, we can't find anything. And I'm like, this man would not find his way out of a medical paper bag. And we've been married for 20 years. But it is insulting then to have people, so I see it from both sides.
Right. Katie, you bring up a really good point, and I think it's really important to remember that, yes, you are right. All of our HIPAA guidelines are in place, and supported decision-making agreement is not equivalent to access to the healthcare record. And so thank you for pointing that out. Individuals with a supported decision-making agreement in place have the legal ability to sign a consent for release of information. And so they still should have, in conjunction with their supported decision making, signed consents per their discretion of who should have access and have the ability to communicate related to their healthcare. So for example, if you have a supported decision making agreement in place and mom or Aunt Linda is the designated supporter, the individual with a disability still needs to complete a release of information that releases that so that mom or Aunt Linda can make that phone.
That's good to know. And I know I learned too that like if a power of attorney isn't activated, that's nothing. And so again, we get very indignant, well, I'm her healthcare power of attorney. We went to a lawyer and I'm like, I get it. Like you went way above and beyond just signing a piece of paper, but actually it doesn't count for this. So again,
Right.
I don't know. I feel like we'd need like a whole officer, kind of in every clinic just to be like making sure the paperwork is up to date, because I feel like, again, whoever is putting these documents in front of these people to sign really ought to be saying, and by the way, it seems like this would go without saying, but this is a whole other form and let's be sure to sign it, but it doesn't seem like it's happening.
Yes, I think that is definitely a challenge, and it's even at UW, as you know, I work in that same amazing system. Yes, I have a legal department that's going to help me guide. Sometimes it gets really tricky, and they make it really
Oh
complicated.
yeah. You're damned if you do and you're damned if you don't. That's what sums it up, I think.
And if you're on call at 7 p.m. on a Saturday evening, they're not immediately
No.
available to you, and that is it is frustrating, and I get it. And I have those conversations in my clinic also. People, come in with their loved ones, their parent, and they'll say, "But I'm the power of attorney." And so, yeah, we get to go into that explanation of when that document applies. So I think you're right. It is, and that's exactly part of out here doing this work, right? Is trying to help people understand and just continue to further that work. But it is, I acknowledge the challenge, Katie, and I wish I had an easy answer for it. I don't, honestly, but I keep doing the good work. We're all doing it.
Appreciate it. Well, and again, if there's anything that can be done, I guess, from that after hours perspective or things like that, because definitely, a lot of things I see like patient education wise or those types of things, it's like always in this mythical, like you said, well, you would just call legal or you would just call the social worker, and it's like, but if your entire job takes place when they leave or aren't here yet, let's maybe have a plan for that too. So if there's any
Great point.
input that can be given, I'd be happy to try to help, because obviously I have a vested interest kind of both ways and trying to plug the gaps in that particular part of the system.
Absolutely, absolutely. All right. Well, I want to be respectful of times. We're a few minutes over here, and I know that there is other activities and events for the day. So if you have other questions that come up, please don't hesitate to reach out via Tim, and he will get it my way so we can explore it. And we are planning to meet again next Friday, is my understanding, back to our 9 a.m. time, if that sounds good. Oh, Tim's 9. Yes, Tim's holding up fingers for me. 9 a.m. All right. Everybody, have a great day, okay?
Thanks so much. Take
Thank
care,
you.
everyone.
Yep, you too.